want to talk about temporal mandibular joint disorder. Okay. First, let me show you a picture of the temporal mandibular joint. Picture is worth 1,000 words. Here is your temporal mandibular joint. It's called your temporal mandibular joint because it is a joint between your temporal bone and your mandible. Kind of between your ear bone, I don't know what else I'd call it, because it's not exactly just your temple, and your jawbone. And lots of people will say things like, and there's nothing wrong with this, don't correct them, but a lot of people will be like, yeah, I've got TMJ. Everybody has TMJ. I hope you have TMJ, or you couldn't tell me you had TMJ. TMJ is saying, I have a jaw joint. What they mean is I have TMJ syndrome. I have TMJ dysfunction. I have a TMJ chronic problem. I've got a problem with my TMJ joint. That not everybody has. But everybody's got a TMJ joint, essentially. And that is your jaw joint. Yeah? Cool. So, the problem is when problems occur with the temporal mandibular joint. And the reason I was excited to tell you guys about this, it is a highly massageable problem. So it is something that massage really applies to. Actually, I don't know if this picture really helps you much more. Let me see if I get another one. These are some of the symptoms that people have when they have temporal mandibular joint syndrome. They will hear buzzing or ringing in their ears. Now, why would you hear buzzing or ringing in your ears?
Maggots.
Did you say maggots? Thank you, Mr. Blyden.
No, I said tinnitus.
Oh, it's funny. It's even funnier that I heard maggots, huh? Yeah, tinnitus. Tinnitus. Yes, the ringing, kind of inflammation in this area, and your jaw joint and your ear are right next to each other. Right next to each other. If you look at this, look at where the ear canal is and where the jaw joint is. They are right next to each other. And so inflammation in your jaw joint can actually cause ringing in your ear. Of course, we think of temporal mandibular joint syndrome as having things like clicking, popping, pain in your jaw. All that kind of stuff is really pretty normal. By the way, all of your jaws probably click from time to time. That is not necessarily a bad thing. But we're talking about pain in your jaw. People get problems with their teeth because their temporal mandibular joint's not working well, so they sometimes grind or lock their teeth in weird positions. That means they get mouth discomfort, their jaw discomfort. Sometimes they experience problems in their eye because the nerves from back here kind of feed into the eye, and so pressure on those nerves can cause some problems in their eye, and of course we get headaches too. Somebody might have some or all of those. Does that mean if you have a headache, you have TMJ syndrome? No. But you could. So here's the big cincher about TMJ is they don't have a really good treatment for it. So they used to do surgery for it. And it used to be if you talked to a surgeon, he would tell you or she would tell you that you should try surgery, but now even a lot of surgeons are shying away from surgery because it doesn't work. What they would do for surgery, by the way, let's see, no, sorry, that's way too far. What they do for surgery sometimes is come in here and kind of shave down the bone a little bit so it wasn't clicking in here and things like that. But the problem is it's a very delicate little joint and it just doesn't work very well. And usually scar tissue builds back up and the person has just as many problems as they did before. So they try all sorts of stuff for TMJ, and they've actually found one of the only effective things for it is massage. One of the only effective things for it is massage. And they massage 4 muscles mainly when we work on the TMJ thing. Thank you. We tend to work on a muscle called the temporalis, which actually is on your temple and inserts down into your jaw. We work on the masseter, which is right here. You can actually see people's masseters on many of their jaws when they're chewing. They kind of flex right here. You can see on horses really good, like their masseters. And then you've got tiny little muscles that run kind of horizontally here inside and outside your teeth called the pterygoids. you've got medial and lateral pterygoids. And we massage those too because they actually control how your jaw works. And so, do I have a jaw here? I should have a jaw here. Hold on. Let me grab a jaw. I heard somebody using their jaw. Okay. So, one of the things too is when you chew, it is natural not just to open and close your mouth, but to open it and bring it out a little bit and then back in. That is a normal action to kind of come out and back in. We're very complex chewers. Many animals are, by the way, chew in all sorts of ways. You know, cows chew with a lateral deviation because it helps grind down their back teeth against the grass that they're chewing for the 14th time. But anyway, those pterygoids tend to affect tension on that jaw joint and let it come in and out properly, and so loosening that up can really, really help. We also don't know why, nobody knows why, all sorts of really good theories on this, but neck and shoulder tension seems to tie directly into TMJ. Neck and shoulder tension seems to make TMJ syndrome worse. TMJ syndrome makes neck and shoulder tension worse. And so loosening up neck and shoulders and jaw stuff makes a big difference. And for a lot of people, if you think about it, the cool thing is with problems like this is usually we're talking about a millimeter somewhere that's off. And so loosening up all this stuff here can be often enough to kind of make their TMJ syndrome go away. Of course, the swelling has to come down in their jaw and it doesn't all go away at once, but it is a highly massageable situation that we will actually talk about later more when we get into the temporal mandibular joint, when we do the skull. But you will hear lots of clients come to you and they'll say, I think I maybe have TMJ. And they mean TMJ syndrome or dysfunction. And we don't know what causes it. But we know that the jaw joint gets irritated and nerves get irritated in here, and that creates problems with it locking open, clicking a lot, pinching on this nerve, irritating itself a lot. We also know that it's related to stress. And for those of you that like to kind of go in this direction, which I actually do myself, I also wonder if it's not tied to people that want to say something but cannot. So that might sound like a strange statement to make, but I think that your body is very literal. So, and by the way, if you disagree, it's totally fine. I could be just a nut. But your body is very literal. And it really wants to carry out my commands. And if I say move my arm across this way, it does. Well, a lot of dysfunction is when we give ourselves mixed signals. Now, we've all done this emotionally. We've all done this emotionally. I should keep this job, I should not. I should stay with this person, I should not. And we find that actually the stress of having those two different ideas is worse than either one of those ideas, right? We're giving ourselves two different ideas. Well, if you're somebody who feels like you really should speak up for yourself, but your boss will fire you if you do, or you'll get kicked out of the house if you do, or the myriad of things that could be stopping you, you are sending the signal of, I really want to speak something right now, but I have to clamp down on it. And I think that creates a lot of tension in the jaw. Now, if you agree with me, don't go telling a client that. Because they're going to feel like you're judging them. And we don't mean it that way. We just mean they're getting conflicting signals to the body. But look for conflicting signals and stuff. It's not just, emotionally and with muscles and all sorts of stuff. We see this in the body all the time if muscles are fighting against each other. And so your brain is quite literal. And it really does hear like, speak, don't speak. And that's putting your foot on the gas, taking your foot off, putting your foot on the gas and the brake at the same time. So that's a little tap's got 2 cents about temporal mandibular joint syndrome. But at the bare minimum, releasing tension in the 4 main muscles in the jaw, temporalis, masseter, pterygoid lateral, pterygoid medial, can do a lot to just loosen up the jaw joint. And by the way, hit the neck and shoulders heavily. And that can be enough. And some neat thing about TMJ sufferers is they'll come weekly. They'll come weekly for massage. So it's good stuff. Cool. Questions about temporal mandibular joint disorder?
Does chewing gum, I guess, exacerbate the pain, or does it work kind of the same as massage?
I don't know. And it could be individualized per client. I don't know. It just depends who you talk to. The people I know with TMJ avoid chewing anything. It bothers them. So I don't think it's helpful. However, not using your jaw at all is not helpful. You know what I mean?
Gotcha.
Yeah. I don't think it's therapy. How's that?
Okay. Am I going next?
You are going next, sir.
Okay.
How do you feel about that? You don't sound very confident. You don't sound as
Well,
confident.
I may have done the wrong assignment, and that's why I'm asking.
Okay.
So,
What assignment did you do? Because it might be okay.
well, I also looked at the information in the book first, but then I wanted to look for more resources. So I Googled 6 types of joints, and then I kept getting, I feel like I got 6 types of synovial joints, but then I realized that that's the same one that Brown has, but he only has synovial joints, not 6 types. So I don't know. I'll just go with what I got, I guess.
Sir, you're correct. I was hoping that. All right. So full disclosure, we were done at shin splints and temporomandibular joint. I had 2 of you left at that point because I was doing the alphabet backwards. And I was like, well, what's the most important joint to do? Synovial joint. I just wanted an overview from Mr. Brown. And then there are 6 types of synovial joints. They move certain ways. And so I just gave that to you because I thought, wow, these would be good recaps. So you did the right homework.
Okay, cool.
Yeah,
So I guess, I'll go ahead and start, if that's okay with you.
It's very okay with me, sir. I love your attitude. Take it away.
Okay. Let me just pull up my screen so I can show my little example.
Cool.
So I really like this picture because it kind of gave. Can you see my screen?
Yes, we can.
So this picture kind of gave us an example of where to find each of those joints in relation to the body.
Mm-hmm.
We can see them in the book of what each joint looks like and the shape of it, and they give examples like, oh, it's in the carpals. But I think also having that visual of where it is in relation to the whole body kind of helps put 1 and 2 together. So we have the 6 types of joints, the ball and socket joint, which is the one that I feel like we're the most familiar with that one because it's in our shoulder and also in the hips.
Yep.
And from what we've learned so far, the one in the hips is more of a ball and socket than the one in the shoulder because it actually goes inside and it's kind of more secure in there and there's less of a likelihood for it to dislocate like in the shoulder.
Yep.
Also, there's the hinge joints, which is on this thing here, shows at the elbow. So the easiest way, I guess, to remember the hinge joint is like the hinge of a door, where you see that is how the door is able to open and close and kind of like stay on that same plane.
Yes, well said, sir. If I can interrupt, not because you're not doing a great job, you are. That's why the elbow can only do a flexion or extension because it's a hinge joint. It can only open or close. That's it. Yeah, and you said that, by the way. Please continue. That's great.
The condyloid joint is going to be in one example, I guess, is in the wrist area.
Yeah.
And that's the joint where the thumb and the first carpal meet.
Yeah.
Or wait, the wrist.
It's where it's where your carpals and your radius meet. Your carpals and your ulna meet. Yeah.
So that's where that meets at, and I think that one's a pretty cool shape. Although I still can't really picture how that shape that's in the picture that I have here is in relation to where where the ulnar and the radius and the carpal meet. But
some people call it an ellipsoidal joint as well, meaning ellipsoid, which is like egg shaped. It's really kind of a lame classification. It's kind of like a ball and socket in a way, right? With no socket. It's kind of this flat teaspoon rubbing against another kind of thing. So, yeah.
And then the pivot joint. So that is the one that allows, I always remember that one by saying like a pivot point. Like that's where you keep your foot planted. Like I think that's in dancing or in some form.
Yeah, it is.
Or martial arts, you keep your foot on the pivot. And it kind of has that the place where everything meets in the middle, and it kind of just revolves around that. And that's usually found in the atlas and the axis, and
Yeah.
are
C2, C1.
yeah, C2 and C1.
Beautifully said.
These gliding joints. Now, this one I didn't quite get, but from the information, major gliding joints include the intervertebral joints and the bones of the wrists and the ankles. So those are the carpals.
Yeah, the carpals and your vertebrae, they're saying, are gliding joints. It's just an excuse for them to talk about two bones that are basically the same. And they move very little, really, right? They can do this little stuff. But we said if you got 24 of them together, you're doing great. But that's a gliding joint. Yeah.
Right. And then the saddle joint, just the way that it is here in the picture, it is kind of like a saddle when you sit on a horse. So it's showing like how the two joints meet as a saddle joint. And that allows for flexion, extension, and other movements. But that are the only movements that it is able to do with that type of joint. So I think it says the thumb has a saddle joint, and it helps your thumb cross over the palm of your hand. So when you're opposition, that is basically what that joint allows you to do.
Well said, sir. Cool. Anything else, sir?
Yep, I think that was it.
Okay. Well done, sir. Thank you. So Mr. Blige makes a really good point about all these joints. Do not stay up at night memorizing all these joints. The reason the book introduces them to you, and the reason they're important, is we want you to just be thinking about the movements that are available at a joint. So when you're aware that your elbow is a hinge joint, you're aware it can only do these two things. It actually can't go over here. That was my shoulder doing that. It has to stay right, like doing this. And so just being aware of like this, a pivot joint, kind of gives you some ideas about what the thing could do if all the muscles were working well. So we're trying to get you to just think about different types of movement. This all is going to tie into kinesiology down the road, but we're not going to be constantly going, is that a pivot joint, a saddle joint? It's not super important. Later you'll be able to kind of just tell, trust us. But we wanted you to think about this, to be thinking about the fact that there are different joints. And obviously you expect your garage door to operate different than your front door, different than a rotating door when you go into Macy's or something, right? Because they're different joints. Cool. Thanks, sir. Well done. Mr. Brown. Mr. Brown, Mr. Blige was kind enough to tell us about 6 types of synovial joints, but can you give us an overview of what is a synovial joint?
So I'm talking about synovial joint. No, I'm playing. So a synovial joint is am I saying that correctly? Synovial?
Yeah, you are.
It's the most common joint, and really based off of the 6 types of joints, are there any other joints other than synovial joints?
Yeah, there are. Well, there are, by the way. There's, but they don't move very much.
Oh,
so there's
okay.
fibrous connections and cartilaginous connections, and they just don't move very much. Synovial joints move a lot. They may only open and close, but this is a lot of movement. As you can see, an arm flying by the screen. Whereas that's me moving my skull bones, and I'm just moving my hair right now, but the point is you see very little movement there. That's a fibrous connection. So with synovial joints, what makes it a synovial joint, sir?
A synovial joint is, well, it connects cartilage. It's also called the diarthrosis, but that's like beside the point.
No, it's not actually, which means a highly movable joint, that word does.
Oh.
Diarthrosis.
I didn't look into the other name of it, I just looked into it, but it's got like a fluid.
Yes, it does have a fluid. Good. What do you suppose the fluid is in a synovial joint? What do you suppose it's called?
Hold on, let me look through my slide notes here. I don't have the
You're going to laugh when I tell you.
Say that one more time?
You're going to laugh when I tell you.
What is it? I didn't look into I just got like a basic overview.
Synovial joints have what kind of membrane around them?
Like fibrous?
Yes, and they call it, this is going to, watch this. Synovial joints have a synovial membrane around them. And they're filled with,
Synovial fluid.
yeah. They keep it pretty simple. Cool. Can you tell us any more about them?
Well, it can be massaged, but like
Yeah, you can.
as like you would. Well, I don't. Not everyone's in Miss Bauer's class, but Miss Bauer, she like gave us an example on how to like massage the knee. You go around the patella and whatnot.
Yeah.
Like you can. That's a synovial joint. You can massage the knee, and
Yeah.
same with the elbow. And it doesn't like. It's not a contraindication, so you can massage synovial joints.
Yeah, you sure can. We don't usually dig into them, but you can definitely massage them, and I actually think it's a good idea to massage them. But you kind of massage over them instead of into them. But yeah, it's good. Anything else, sir?
What else do I have written down?
It's okay if you don't.
Connect bones. Huh?
Yeah, it's okay. I just want to make sure I didn't cut you off.
Oh, they connect bones, and they. Oh, yeah, I do have the synovial cavity. Is what they're the membrane that you were talking about. Yeah, I have that. I had it as a cavity instead of a membrane.
Well, the membrane creates the cavity. The membrane creates the empty space. That's all they're saying.
Oh, okay. And that's about all that I have.
Cool. So synovial joints connect two bones together. What makes them what they are, there's all sorts of stuff we could talk about, the hyaline cartilage over the end of the bone, all that kind of stuff. But what makes them a joint, really, is the fact that they have a synovial membrane, which is a giant sealed water balloon around both ends. Both the bones are here. They are sealed in with this water balloon, which is called a synovial membrane. It is very strong, and it secretes inside it synovial fluid, which acts as an oil lubricant for this joint, which is the most common joint in your body, synovial joints. Yeah.
And the most movable.
And the most movable, which is why you said they're diarthrotic, which means the most movable. Whereas fibrous joints we call synarthrotic, which means without movement. All right, good job. Thank you, sir. Miss Estes.
I have shin splints.
Yes, you do?
I do.
Okay.
No, I don't have them.
Okay.
But
So, by the way, I could see lots of different ways this could go, so don't worry. Like, this is actually, shin splints are actually an interesting thing to talk about depending on how you interpreted this. And there's no wrong way. So, what are shin splints, Miss Estes?
shin splints is a term that refers to the pain that arises in the shins, which are the front lower legs. And it's referred to as medial tibial stress syndrome, which is basically inflammation of the muscles, bones, tendons, and tissues around your tibia or your shin area.
Yeah. Okay. Cool.
Yeah. And it's caused by like strenuous activity, overuse, over exercising, maybe doing weird things on pavement, like walking up hills or down hills with improper shoes or, things like that.
Yeah.
Doing like basketball or like a lot of those sports that you like stop really quick and then maybe pivot and turn and stop and start a lot.
Yeah.
That can do it. Yeah. So.
And what did they say it was? Inflammation?
Inflammation. Yep. And the around the tibia.
Yeah. I would say that is probably the most accurate thing you could say about them these days. So here's the deal with shin splints. Well done, by the way, Miss Estes. That's what I would say too about them. But I want to add a little bit to this because you're going to hear the term everybody thrown around a lot. And as a massage therapist, you will hear shin splints a lot. It used to be that shin splints really meant hairline fractures in your tibia or your fibula, in your shin. And you could get them from overrunning and things like that, and they need rest. It's not crazy to get hairline fractures in your bones, but they need rest to repair. But then it started to become this kind of just term for soreness in your shin, and Miss Estes, I really feel gave the clearest definition of how we use it today, which is really inflammation, believe it or not, in the periosteum, which is the fascia around the bone, and sorry, I'm just drawing a blank really quick, but the fascia between the two bones, between the tibia and the fibula, there's interosseous membrane. Thank you. Interosseous membrane, which just means the membrane between the bones, fascia between the bones. Well, lots of muscles attached to this area, and so the constant pounding and moving, as Miss Estes was pointing out, can really pull on this area and create inflammation in that tissue. So it's not hairline fractures, it's inflammation in that tissue on the bone. But the last thing I want to say is people also say they have shin splints just when they're sore in their anterior tibialis, just when they're sore in their shin muscles. And I wouldn't correct them. I'd just be aware that, by the way, all of it responds really well to massage. All of it. So, because it gets blood down in that area. So it responds really well. Last comment here, personally think that the anterior lateral compartment of the leg, the crural region, anterior lateral compartment of the leg, is extremely important. I'm about to sneeze, sorry. Extremely important to massage, and most massage therapists don't rub it. So think about it. I'm talking about rubbing the shins. I'm not talking about rubbing the shin bone. That really, really hurts. But if you drop off just a little bit laterally to it, just a tiny bit, you're in the tibialis anterior tibialis. And if you go a little bit more over, you're in some toe flexors, extensors, sorry, and a little bit further into these things called the peroneals. But all of those have a lot to do with pain down in that area. So all of it makes sense. True shin splints tend to actually be on the medial side of the tibia where all that tissue is. Well, actually it could be anywhere. Never mind, forget that. It could be anywhere. Never mind the last statement. And I don't even know what a true one is. But she's right. Inflammation in the area is a true shin splint. Lots of people though describe muscular pain down in that area as shin splints. They all work quite well. And what did you want to ask Miss Walker before I ramble myself into some other erroneous statement?
Would you just apply as much pressure as they could handle?
Yes. I'm so glad you asked that. Yes, I would. I basically do all of my massage applying as much pressure as you can handle. Now, as much pressure as you can handle based on your, emotional preferences too. So I'm not trying to do every massage where everybody's like, right? But if you're a person that likes, then I try to do my massage like that. If you're a person that's like, I just like to feel a little bit of whatever, then I still try to run it at that level. I try to run my massage as hard as you can emotionally and physically handle, and it's an unpleasant experience for you. I don't know how else to say that. But yes, and by the way, a lot of people in their shins can take a tremendous amount of pressure. A tremendous amount of pressure.
Shin splints, they hurt like crazy. So I should know, since it's already all inflamed, if we would go a little wider than they could handle. I'm sorry, still inflamed or not, but it's stop.
No, actually, if they can handle it, I would do it. The area is very avascular. It really responds well to rubbing. I'm not talking about on the bone. I'm talking about on the muscles down there. I would hit them really hard if somebody would let me. And I would actually even massage the bone directly. That I would not hit hard because I'm rubbing the fascia around the bone, the periosteum, and there I'm actually trying to go soft and just stimulate it and such. And that I would be careful about. But again, not because I'm going to cause damage really, but just because it's not effective. But I would caution you all to do your massage as deep as the person is okay with. Right. It's okay, by the way, if they're like, I don't like any pressure at all. Okay, that's what you're okay with. That's it. But if they can take more pressure and it doesn't bother them emotionally, give them more pressure. Because I'm getting to deeper layers and I'm getting more done. I mean, just think about it kind of in a weird logical sense. How long do I have to rub my arm at this pressure to loosen up these muscles? 4 years? So in theory, if I go deeper, I get more done. In theory, as long as I'm not damaging tissue, deeper is better. As long as I'm not damaging tissue or a person's psyche, by the way. They come in there crying, they don't want to be beat up again, and you're beating them up. That's not good too. But if you're not damaging them emotionally or physically, you want to go as deep as possible because you'll get more done. They will like you over other therapists, and that's true 100% of the time. Anything else, Ms. Walker? D?
No.
No. Good. Thank you, Ms. Estes. That was really well done. So basically, we're talking about inflammation in the shins. Yeah, I love it. And you can massage it. Good stuff. Let's see. Oh, Miss Hawks. Spondylosis.
All right. So spondylosis is caused by aging. It's defined as the age-related wear down of spinal discs. So basically, over time, our discs dehydrate and they shrink, which causes pain and problems. So this condition is often used to describe osteoarthritis. And the most common areas that are going to be affected are the neck, so cervical spondylosis, and the lower back, which would be lumbar spondylosis. This disease process can produce bone spurs, also known as osteophytes, which can put pressure on the nerves in the spinal cord. So having previous spinal injury would be a predisposition for spondylosis, but mostly it's usually just caused by aging. So by age 60, 70% of women and 85% of men have signs of spondylosis.
Mm-hmm.
And as far as massage goes, massage can actually help with the symptoms and the pain.
Yeah.
We kind of want to make sure that the client's comfortable in the different body positions and be sure to address any coexisting conditions such as herniated discs. And that's it.
Yeah, that's fantastic, actually. Thank you, by the way. That was well presented. Yeah, spondylosis is, it can be all sorts of things, really, but really, as we age, we start to lose space in here. And that can cause pinching of nerves. Spondylosis can also, you can also get bone growths in here and things like that. And massage is actually one of the best things for treating this, not because it makes it go away. It doesn't do that at all. But because there aren't really any other things to treat it. You can go in here and fuse these discs so they quit moving and they quit pinching on these nerves and stuff like that. But that's pretty major surgery. So you'll get lots of clients that come in and say, I've got spondylosis. That's nothing to worry about. I would be careful if you're stretching them and twisting them. If it hurts them, and especially if it radiates pain out down their body, then don't do that stretch. But you can rub their back super duper hard. Remember, all these nerves are underneath a lot of bone. A lot of bone. You're not going to get to them. So it can provide a lot of relief for them. Yeah, thank you, Ms. Hawks. You're right. It's very massageable, and it's common to get people with spondylosis. Common. Yeah, thank you. Miss Carodi. Ms. Carodi, you were going to explain to us what lordosis is. Lordosis. It sounds, yeah.
It's like a normal hyper, like a little bit for the side, but lordosis people have way more because something happened to people getting obese, like a fat, or people have a pregnant, so that getting big of a really high with the stomach side, making the people have a lordosis.
Yes.
And you can see go doctor visit, and you can do the massage too, but have to put a pillow underneath the leg or side, or side like a bolster, like underneath the leg and a pillow.
Yes.
The side pillow. What was that? You can put a bolster underneath the leg or even a pillow to the side, lay on the side. But you have to do the massage really, really careful because side probably getting people getting way more hurts. I mean, yeah.
When they're on their side, it might hurt more?
Yeah.
Okay. I didn't know about that.
You got to be aware. You got to just make sure that they're comfortable.
They're
Because their comfort is number one.
Yeah,
So,
making it comfortable
you know,
first.
bigger bolsters,
Yeah.
Yeah, I agree.
sideline for pregnant late term.
Yes.
Yep.
They do the more the bone
This.
physics that can pop out and that can really painful. Like my husband.
So, I'm sorry, by the way, I was trying to help you, Miss Crody, by posting a picture of lordosis, but all I had was kyphosis. Anyway, they're very similar. So, lordosis, I always think of my grandmother walking around the house with her hand on her low back and being like, oh, Lord, lordosis. Normally, lordosis is an exaggerated curve of the lumbar spine. It can be an exaggerated curve of anything in a way, but it's that inward. Your low back is supposed to curve inward if you're behind somebody. This is one that curves very inward. Some people even call it hyperlordosis, and it's an exaggerated inward curve of the spine. Yeah, and you're right. Client's comfort is most important. You can massage it, everybody. We will study what muscles might be tight that can create lordosis. There's all sorts of interesting things that can create lordosis. Just something for all of you to think about is tight back muscles can definitely cause some lordosis, right? But also tight hip flexors can, because when my hips flex, it tends to make my back bend in more. So tight hip flexors in front and tight spinal erectors in back can lead to conditions of lordosis in your low back. And so we would definitely work on loosening those up. And we will talk about all those hip flexors for sure, and all those back muscles, yeah. Anything else, Ms. Carodi?
No.
No. Thank you. Thank you. It was good. It's good stuff. Okay, and now I got to remember where I was. Hold on. Let me. Come on. Oh, geez, this is a long one. Sorry, Miss Lobitz. Patellofemoral pain syndrome.
All right. Patellofemoral pain syndrome is pain at the front of the knee or around the kneecap. It is caused by the softening or degeneration of the cartilage on the back of the patella. It's associated with, be a couple of things: overuse, such as doing activities that put constant strain on the kneecap, injury or trauma to the knee, or even muscle imbalances and weaknesses. Another name for it is runner's knee. This is because it's more common in people who participate in activities that involve running and jumping. It can also be aggravated by walking up or down stairs, or if you're sitting with your knee bent for an extended amount of time. Patellofemoral syndrome is more common in adolescents or young adults. In older populations, knee pain is usually related to arthritis. To prevent or limit knee pain, it's important to warm up and stretch before physical activity. Also maintain strength in your legs and thigh muscles and have proper form when working out. And of course, have proper fitting shoes with good support. For massage purposes, it's important to ask about medical conditions or injuries to identify these issues, and to have communication when working on those areas so we can adjust pressure or technique as needed. And then for patellofemoral pain syndrome, massaging the thigh muscles are important, especially the quadriceps, because they have insertion points at the patella. That's it.
Nicely done. At the end, very clear, very easy to understand. I've got a little model here of a knee, and your quad's actually insert into this tendon here, and then this is your patella. Remember, it's a sesamoid bone. It would actually be completely covered by this. But patellofemoral syndrome, pain syndrome, is when this guy is not interacting nice with this guy. And if you think about it, they have to rub over each other all the time. And there's even a groove that it fits in here. And it's important that it fits in that groove, by the way. This one's not doing so well, so this person would have knee problems. But anyway, if it doesn't fit in that groove, that is a problem. And so, yes, massaging the thigh muscles can help to loosen this up. That's super helpful in treating it. Strangely enough, doing leg extensions at the gym to strengthen these muscles also helps, because it also helps the tracking of this guy. It helps teach him to track properly. And so, anyway, those are just good pieces of advice. But we were actually talking not about wear and tear between the femur and the tibia, but the actual patella rubbing over those things. Yep, and people that have it, things like stairs and stuff sometimes bother them, even when other activities don't, like running or whatever. Certain angles, certain bent angles hit it just right where it's not tracking quite right. But anyway, loosening up the quads really does help, because it helps it fall into place and do its track. It's got a natural fitting track there. Any questions? Comments? No? Okay. Osteoporosis. Ms. Bades, would you be so kind as to tell us something about this?
Yes. I was assigned osteoporosis. And osteoporosis is a disease condition in the bones. Tissue is brittle and fragile, causing loss of density and strength, become thinner, and increase the probability of pain due to fractured bones. Leading cause of osteoporosis is gap and low levels of estrogen hormones. Factors that increase the risk of developing osteoporosis are females of Caucasian and Asian ethnicity, ages 60 plus and over. And also taken in consideration are cigarette smoking, excessive alcohol consumption, lack of exercise, and a diet low in calcium. So with that said, a proper and healthy nutrition, good general health is beneficial and essential to prevent osteoporosis. And I would continue with the massage, just using less pressure. And I would communicate with my client, throughout the massage to see if I need to adjust the massage pressure.
Yeah.
And that's about it.
Cool. So osteoporosis is bone loss.
Bone
Right.
loss, yeah.
Bone loss.
That's right.
It's accelerated bone loss in somebody. And it can be due to all sorts of things. There does seem to be a genetic component. Some people are just more prone to it than others. But also, if you're not doing any weight-bearing exercise, which is walking, running, things like that, your body does not have the stimulation to the bones to think that it needs to keep rebuilding them. So that, low calcium, those type of things cause problems with that. Consideration for massage is be a little careful, but I wouldn't be paranoid. Here's why. Yes, their bones are more fragile. So this is not a good time to do a backhand spring up on the table and land on them with your feet. I got that. But this person came walking in. And if they came walking in, they can withstand a certain amount of pressure to their bones. People with osteoporosis, unfortunately, really where they get into problems is when they fall. So people with osteoporosis, when they fall, they tend to break a hip or something. Whereas I just fell the other day, actually, strangely enough, at my house. It's a long story. I was playing with a kid. But I fell, and I didn't break a hip because I don't have osteoporosis. So I just looked like a fool. And so if that client doesn't fall, you're probably okay. So I would not do heavy, like crushing down the table, because I know this person has slightly weaker bones, but they're not going to just turn to dust if they can walk in. Does that make sense? So like, be judicious, but please don't be afraid to touch these people. But also if I have this stuff from like Thai massage where I kneel into your glutes with my knees and you're holding my entire body weight. I would do that to anybody in this class, but I wouldn't do that to somebody who is aged and said they had osteoporosis. It's an awful lot of pressure on their pelvis, right? And I would not want to break it. So I wouldn't go crazy. But I don't sit there the whole time being like, oh, am I pushing too hard? It's not a problem. It's really not a problem. They're going to be basically fine. They do have to be careful, by the way, but not for massage so much. Thank you. Smaras.
Thank you.
Rheumatoid arthritis. Miss McDowell.
Okay. Let me. Hold on.
Yeah. Take your time. You probably have an entire stage presentation. You're getting the backup singers in there. Will there be a little interpretive dance? No?
No, I'm just trying to get the
Stuff up?
Oh no, this isn't the right window that I want to share. I'm trying to share my slideshow, but I don't.
You know what? And by the way, this is not because I'm getting impatient with you. I don't feel that way at all. Not even a little bit. But I also realize it's 9:44. Why don't we take a 15-minute break? We'll come back with you. And that'll give us time to mess with that and all that. Is that okay?
Yeah, that's
cool. All right. Yeah, that was not because I was like, oh gosh, it's been a whole 30 seconds. 15 minutes, everybody. We'll be back here exactly at 5 o'clock. 5 o'clock. Thank you, thank you, thank you. Mr. Riedel, yes.
Hey, so I don't remember being assigned the presentation, so I don't know what my topic is, but can I use this break to kind of put one together real quick? All right, what is my topic?
Gout. G-O-U-T.
Okay. All right, thank you.
Thank you, sir. Good question.
Hey, Mr. Tapscott?
Yeah.
I may have to stay off camera because they keep playing with my face.
Well,
I keep looking at myself and making all these faces.
It makes you self-conscious.
This angle makes my jaw look puffy, like it protrudes out. And I keep playing with it, and it's like I think it's cute, and that's not good because I'm just having fun, and I should be focusing.
Oh, you're fine, sir.
Okay, well, I'm sorry if I'm making faces at you guys.
I didn't catch that.
Okay, good, good.
What time is the break over?
5 o'clock.
Okay.
Let's do this thing. All righty. All right, all you wonderful people. Okay. Are we back? Yeah? Hi, June. I did what you told me to do. I waited. Okay. Miss McDowell. Miss McDowell, you look all peaceful there. It looks like you're ready. Feeling good about this. Let's see.
Yeah.
Let's see what happens.
Okay.
What's the worst thing that could happen? The worst thing that could happen is we could catch rheumatoid arthritis.
Oh, don't say that.
Okay, good. I won't. You're going to tell me why I can't catch it, so go ahead.
No. Yeah. The browser actually froze the last time I was trying to do this, so hopefully it doesn't do it this time. Let's see. Is it doing anything?
Yes. I see
Now,
a picture of a rheumatoid arthritis joint with a big red circle on the right side.
is it in the... Hold on.
It is not
Slideshow?
showing. Now it's in the slideshow.
Okay. Alright, so... Rheumatoid... I'm presenting. Rheumatoid arthritis is an autoimmune disease or disorder, which means you can't catch it. It basically means that the body is attacking itself. You can see from the picture here, if you have rheumatoid arthritis, your body thinks that the synovial membrane or the soft lining around the joints is a threat, and it attacks it. So you can see, like with the red circle, it's all angry there and the cartilage is wearing away. So when this happens, fluid can build up in the joint, and with the fluid buildup causes swelling and also pain, sickness, stiffness, and inflammation of the joint.
Yeah.
Here's another picture. This is kind of what it can look like. Sometimes the hands can become deformed. It's not just in hands, it can be in like other places like elbows, feet, like places with a lot of joints. There's no cure for it because it's an autoimmune disease. But the Arthritis Foundation recommends massage to reduce pain and improve function of the joints.
Yeah.
More going into massage. They don't recommend vigorous massage for rheumatoid arthritis if they're having a flare-up.
Yeah.
They recommend gentle massage. It's very slow and even pressure. Not recommended also is like range of movement because the joint is damaged and it could hurt them. So that's pretty much it there for rheumatoid arthritis.
Yeah. Well done. I like how clear and concise that was. Thank you, Ms. McDowell. Because we're not looking for volume, we're looking for clarity. And so it's an autoimmune disease. Autoimmune diseases, you will hear about this again later, but they're fascinating diseases where your immune system attacks yourself. It thinks, in this case, it thinks your soft tissue in your joints is a foreign invader, and it attacks them, and it's pretty good at it. And so it starts to make those areas swell and be inflamed. And autoimmune diseases are very hard to fight because one of the ways you would fight them is to cut down on your own immune system. Well, that's fine and dandy. Now your joints don't hurt, but you catch bubonic plague or something, right? Like you can't fight off other things. You need your autoimmune, system. Stuff like this often makes me ask myself too, like if I'm being hard on myself, I sometimes wonder if, that's not kind of attacking yourself with your own defense mechanisms there too. So, sorry to relate everything to that, but I think there are some close relations. Anyway, well said. You can massage it, absolutely. You don't massage it in a flare-up. How will you know it's a flare-up? The client will tell you every time. They'll be like, I'm having a flare-up. I don't want you to touch it. But it's strange enough when they're not having a flare-up, sometimes they want you to really get in there and rub. And notice I just don't go in like that. I rub across, but you can be vigorous sometimes. They like it. They'll tell you. You can totally use their feedback. If it feels good to them, it is good. I agree with Miss McDowell. You shouldn't be stretching them. But by the way, if it feels good to them and you're gently doing it, that's fine too. Anything where you're working through it and it feels good to them, you're golden. You're not going to make it worse unless you go along and crank it. Finger back or something stupid. But the point is you're not going to make it worse. It really does respond well to massage, and that's all it responds well to. You know? So it's very cool for that reason. Mr. Blygen, thank you for being so patient. Did you have a comment or a question or something?
Is there, I heard that you can like do some kind of natural things to help with autoimmune diseases, like changing your diet, and stop using certain products with in it that can be harmful, like deodorants and things that like aluminium in it and stuff like. Is that like across the board, or is that just for like with all autoimmune diseases, like those type of things?
It's across the board that some people believe that adjusting your diet and other things can help with, including mental things, by the way, can help with autoimmune diseases. But it's not across the board what will do it for each particular person. It seems to be very unique. And one of the things we really encourage people to, I say we, like I'm some part of some medical team. One of the things that doctors who are 79 times more trained than I am encourage people to do is look at things like, let's try to change up your diet. You've got nothing to lose, right? And they do look at things like, this is not a vegan plea over here, but they look at things like dairy and things like that because they can cause inflammation in some people. They look at all sorts of stuff. And they do look at chemicals that you put on your body because some people are hypersensitive. So some of us can sit there and bathe in radioactive material every day and we're like, I don't know what the big deal is. And another person's like, you know, I smell a hint of lavender in the air and it's too much for me. So really good point. And so anyway, we really encourage people to kind of like go through your diet. Figure out what's affecting it. Go through stressors in your life. Stress seems to kick in autoimmune disorders. So all that kind of stuff, Mr. Blygen, yeah. But it's going to be different for everybody. So it really, I don't know if there's such a good thing as a good thing about a disease, but what I do like about diseases like this is they make people kind of go inward and kind of check out stuff in their own life. And that's true for all. I mean, that's true for everything. But anyway, autoimmune diseases, there are often things you can do to mitigate how often you have flare-ups and things like that. Mr. Tate, did you have your hand up and then take it down? I just think you did. You did. Okay.
Yeah.
Did you change your mind?
Yeah, so my sister has... No, I do. My sister has rheumatoid arthritis, Courtney.
Yeah.
So she has an anti-inflammatory diet that she takes.
Yeah.
That helps her. And yeah, also a fun fact that I learned, she just had a baby recently. And during her pregnancy, it alleviated the I guess the symptoms of the arthritis.
Yeah. Now that might not have been from her autoimmune system getting better. It might have been from some of the anti-inflammatory hormones going around her body when she was pregnant. It might have been both. I don't know, but you've got some good anti-inflammatory medication going around your body too when you're pregnant, which can make some other things feel better. Yeah. Anything else, sir?
No, but not.
No what? I'm sorry.
I said I don't have anything else, but I could go next.
Oh, you could go next.
Yeah.
No, don't, because I'm on a roll. Sorry, sir. Miss Munoz, you are next. Thank you for offering, by the way, sir. Miss Munoz, where did you go? Do. Miss Munoz. Hey, where did you go, Miss Munoz? Yeah, Miss Munoz. Oh, there you are.
Here I am.
Miss Munoz.
I'm here.
Tell me about osteoarthritis.
All right. So osteoarthritis occurs when the flexible tissue at the end of bones wears down. It worsens over time. Joint pain is in the hands, neck, lower back, knees, hips, and are most common. That's the most common where it originates, I guess.
Yeah, we're supposed to commonly experienced.
Yeah. Those are the original where they go, but they can affect any joint. Physical therapy, sometimes surgery can help with pain. Osteoarthritis cannot be cured. Massage can help and decrease swelling and pain, and help with joint movement.
Yeah, well said. Osteoarthritis, I mean, it's different from rheumatoid arthritis because it's not your body attacking itself, everybody. Osteoarthritis is really a wear and tear down of bones, of joints. Usually the hyaline cartilage at the end of the joints is getting worn down and you're starting to get some bone-on-bone action. Yeah, not good. Anything else you need to say about that, Ms. Munoz, or is that good?
Nope, I'm done.
Okay. So yeah, it's a wearing down of your joints. The only thing I don't like about this definition of osteoarthritis is it kind of implies it's just going to happen to all of us, and there's a lot of research to suggest that's not true. So no, it's not your body attacking these joints, but there's a lot of research to suggest that if you're living a healthy lifestyle and doing lots of things like you should with movement and stretching and massage, all this kind of stuff, that these joints wouldn't be hitting so hard that they would be rubbing and they wouldn't be rubbing away. So it's not an inevitable fact of life. That's what I want to say. But osteoarthritis is joint inflammation because bones are rubbing on bones a little bit, or joints are deteriorating. Yeah. Ms. McDowell, please.
I just have a quick question about kind of what you were saying, like if you live an active lifestyle. If someone does weigh a little bit more and they have more adipose tissue, do you think that could maybe help prevent the wear down of the tissues because they have extra of the tissue? Does that make any sense to what I'm saying?
It makes perfect sense. I'm laughing because two things. One, it was really nice the way you said that. That's how you should talk. I like that you said somebody who's a little bit heavier and maybe has a little extra adipose tissue. But I thought you were going to go from the direction of their joints are extra weighted, like they're carrying around extra weight, which I hate to tell you, it's not like they have extra adipose tissue between their joints. Right? So adipose tissue, by the way, is fat, everybody, and it does give you padding. It is helpful. When I fell down at home with the kid I was playing with, right? All my fat helped. I went boom, and that was helpful. But there's not fat between my joints. My joints are just as lean as an Olympic athlete's. We don't grow fat in between the joints, really. And so the problem is that weight does not do you any good for cushioning. What it does, actually, Ms. McDowell, is the exact opposite. Weight does seem to create long-term stress on joints. So unfortunately, people that are overweight are more, that doesn't mean they'll happen. By the way, there's all sorts of people who are overweight that are just bouncing around happy little kittens. But they are more prone to have joint problems. They're more prone to have back problems. They're more prone to have, because they're bearing more weight all the time. Yeah. So they get the long-term wear and tear ones. I like what you're thinking. Yeah.
I thought maybe it would pad in between the bones a little bit more too, but
yeah, as far as I know, you don't gain any fat between your joints, and that's it. So that's all. They're just carrying around an extra half a person, right? I mean, can you imagine if you all of a sudden had to put on a 50-pound backpack and walk around with it? Your knees would start to bother you too.
I know what that's like.
Well, yes, you probably do know from school. Yeah, I understand that. Cool. Thank you, and thank you, Ms. Munoz. That leads us to Mr. Placencia, who is going to talk to us about Lyme disease.
Yes, I'm going to talk to you guys about Lyme disease.
Okay. We're excited, sir. We're excited. People were asking me before you got on the call this afternoon, when's the Lyme disease presentation going to come on? So it's here now, everybody. It's here. Take it away, sir. No pressure. No pressure. But here we go.
Okay, so Lyme disease is a form of arthritis that affects the joints, skin, heart, and your nervous system. Some symptoms include rashes, flu-like symptoms such as a fever, and joint pain and weakness. You get it through tick bites, through little bastards who bite you, and they infect you with a bacteria that gives you the disease. Luckily, it can be cured with just simple antibiotics. As it pertains to massage, you cannot get it from skin-on-skin contact. So the only thing is we would not massage areas that have rashes or skin lesions. That would be a local contraindication. And do not massage if the client is experiencing a fever.
Yeah, I love that.
And also avoid movements on affected joints because it could be tender.
Yeah. Good. So it's not contagious. It's a bacterial infection that you get from ticks. I think only from ticks. I don't know of any other way to get Lyme disease. We're lucky we don't have as many ticks out here. We do have them, but we don't have as many because they're thirsty and they're hot out here. And so they move to nice, wet places. But we do have them. And yes, bacterial infection. And there's really it was very well done, by the way, Mr. Placencia. There's basically no contraindication except that we don't rub rashes and we don't rub stuff that looks swollen, but there's basically no problem. Some people have Lyme disease for a while, by the way, before they realize it too, because they're just like, I'm tired and kind of achy and I can't figure, and they finally go in and get a test and they're like, oh, you got Lyme disease. So very common. Well done. Any questions on that? Okay. Wear socks when you hike. Miss Sarno. Miss Sarno?
Yeah.
You were going to talk about kyphosis, which is the picture I accidentally put up earlier when I was trying to talk about lordosis. So I'm going to show your picture though, okay?
Yeah.
Okay. So here is a picture of lordosis. Yeah. I'm sorry. Here's a picture of, sorry everybody, kyphosis. Kyphosis. And you're going to talk to us about kyphosis. What is kyphosis?
Like the spine of like poster.
Like the poster, yes. Yes. Can you kind of explain it? What are we looking at? I know that's hard.
I sent your email and I think I sent you that. And
Yes, you did. Yes, you really did. I just thought maybe you could try to put it in your own words. Is there anything you can tell us about kyphosis in your own words? Just one sentence.
Okay. Kyphosis is like the posture, like sometimes like the people like work on a long time on the computer and they say that the back they get curved and they get no lower back.
Yes.
And they get like slow and they not sit up straight and the pulling.
Yeah. That was actually really good. I thought you were going to go like it's an exaggerated curve of the back and stuff, but you put it in your own words and exactly what I want you to do. Kyphosis is very common for people at a computer. They're hunched over. It's an exaggerated thoracic curve. Remember, lordosis is too much of a curved lower back. Kyphosis is too much of a curved upper back. Sometimes you just see them together even. But somebody, like you said they slouch. I actually heard you use the word slouch. I love that. Yeah. They slouch at a computer too much and they get this thing. And over time, by the way, the back muscles can lengthen in the thoracic area and the anterior muscles can actually shorten.
Yeah.
Yes. And anything else that we need to know, Ms. Sarno? It's okay if there's, I just want to know. That's the big stuff right there.
Sometimes they call the pain on mid back and the upper back.
Yes.
And sometimes they like style like a tendon stiffness, and they not move easy. Like they
right.
just hook, they pulling and they tight.
Yes.
And hard to move.
Yeah.
And we can massage on that and to have to lose work out like smooth the muscle or something allow the I think that patient they can lie down on the side to
Yes.
work on.
So some people, that's good. Some people with really bad kyphosis can't even lay on their
Yeah.
back because they're so hunched over they don't. Yet we eventually want them to be able to lay on their back. That would be the goal, is to get them to lay flat on their back. So my old school massage teacher used to say, you're trying to make them taller, wider, flatter. He was like, that's a legitimate game plan, just to smush them into the table. And that would be true with somebody with kyphosis. You want them to eventually smush into the table, not in one session. And yes, this is a long-term problem. Can anybody mention anybody? That was good, Ms. Sarno. Can anybody else mention, or you? Thank you. Another problem that could happen. Can you see a problem in this diagram that could happen once I've got this kyphosis thing going on? Yes, Mr. Riedel.
Yeah, your center of gravity would be off.
Thank you, Mr. Riedel. Yeah, so your head is way out over here, and by the way, that causes enormous problems. That person's head in this picture is so far out that 10-pound head to their neck weighs about 35 pounds right now. Because they're not holding it here anymore, they're holding it out here. And it's a huge difference. Now all of a sudden I've got 3.5 times the head to carry around. Would you like 3.5 times the head on your neck? And I'm carrying around, I'm pulling it back constantly. So the other problem that happens is the fascia that in the backside of your body starts to harden up to try to hold this stuff. Because it assumes it's just got to be there. You've been asking it to be there 40 hours a week for 40 years. So it starts to harden up. And so that back area really takes a lot of work to open up that fascia again. Yeah. But anyway, kyphosis is exaggerated curve of the upper back. Lordosis is exaggerated curve of the lower back. That's typically how they're used. Yeah. Thank you, Ms. Sarno.
Thank you.
Let's see. Well, let me stop sharing this, sorry. And where were we? Pardon me. Oh, Mr. Riedel. Gout?
Yeah. So gout is a type of arthritis caused by a buildup of uric acid, which is normally excreted, so it just builds up a lot.
Yeah.
And it typically comes from like the kind of foods that you eat, so like turkey and like seafood, poultry and seafood.
Yeah.
Gout is painful and not curable, so you're kind of stuck with it. But and gout is basically inflammation that can be intense enough to cause fever, muscle aches, and other flu-like symptoms. And so massage is highly recommended for this as a treatment.
Yeah. Yeah. I love that, Mr. Riedel. I think we're getting weird feedback, but anyway, good job. Thank you, sir. Just because of the feedback. Yeah, really well. So gout is totally massageable. It is an inflammation of the joints too. It is highly tied to diet. So remember, when we get a client that comes in though with gout, that doesn't mean that we instantly ask them questions about their diet, because that tends to make people feel very judged. They may or may not be taking those steps towards controlling it with their diet. And who am I to judge? Because there's a whole lot of stuff I should be doing, right? That I'm not always doing. But we do find out that rich foods, strangely enough, especially animal-based foods, really bother gout stuff. It builds up the acid that your body does normally clear, but it builds up lots more of it. And so it can cause real pain in the joints and things like that. And people who have gout usually avoid rich foods. That's what they'll tell you. I avoid rich foods. Very cool. I love that, but very massageable. I love that too. Miss Allure, will you please tell us about ganglion cysts? Sounds like a sea creature.
They're non-cancerous lump full of, how do you say it? The fluid?
I don't know. I'm not giving the presentation.
Okay. It's a non-cancerous lump, often on the tendons or the joints, usually 90% on the wrist. The cause of the cysts are unknown. They're round, small, painless usually, unless the cyst is on the nerve. and they go away usually with rest.
Yeah. Can they be massaged?
Yes, they can, but you want to go lightly and check with your client to make sure
Yeah.
it doesn't hurt.
Yeah, ganglion cysts are interesting, everybody. They are connective tissue cysts. They're not dangerous, actually, at all. You can, yeah, I would even argue if it doesn't hurt the client, you can massage them strongly. I've actually massaged a ganglion cyst on somebody where it broke up, like over just a couple day period of time. And they had it in their wrist, and I just worked that sucker. And it was intense, but we knew it was a ganglion cyst. They'd been told that, and we broke it up completely. It just went away. So they're soft tissue based, and you can break them up entirely. Now, that doesn't mean the client's going to let you, or you can go that hard on it, but they are not dangerous, and sometimes they go away on their own too. But you can really massage them to their comfort level. Yeah. Thank you, Miss Allure. Thank you. Ganglion cyst. I like it. Yeah. Okay. Miss Suriel, you were going to tell us about sprains, I believe.
Yes, that was what I'm gonna go to explain.
Okay.
So I have here that sprain happens when a ligament is torn or stretched farther away. We all know that ligaments connect bones to bones. So also they give support to the body and the necessary motion that is necessary for walking. So I have a picture here. I don't know if you can see it. And then here it shows the bones of the feet, which is the tibia and the fibula.
Yeah.
They're attached to the talus.
Talus, yeah.
And here it's showing how these feet it's in a not good position. So okay, so I'm gonna explain something that I'm missing.
Okay.
When sprains may happen. Sprains usually happens when due to force to a joint into a unnatural and unstable position.
Yeah.
And this can be the cause of an accident or running or doing other exercises. So it's force applied and then usually happens in the joints. Also, I read that sprains, they will heal with time, but sometimes when there is like a really bad major sprain, the person may have problems of stability, and then if they don't take care of it, if they don't go to the doctor, it can lead to cartilage injury and arthritis.
That's true.
And a lot of pain. Yeah. And I have a question for Mr. Tapscott regarding I just didn't want to Google it. I prefer to ask you because you have dealt with this before. If someone comes with you and say, well, I just hurt my ankle with a sprain, is massage recommended? And if we can massage when it's swelling, or we have to wait, or what proceeds?
If they injured it that day or in the last, I'd say in the last 48 hours and it's swollen, don't rub it. Yeah. I'd say if they injured it in the last 48 hours and it's not swollen, to still not dig into that one area. Just because I want to kind of see what happens to that one area. You know how stuff, you injure something and like the next day it's all swollen? Like, that's why I like to give stuff a day or so before it's my massage that's the fault of that. But if it's not swollen and it's been a couple of days, heck yeah, go for it. Rub it. It's highly avascular tissue, and it needs blood flow to heal. And you nailed this presentation in your very first sentence, Ms. Suriel, when you said sprains are problems with ligaments. So, by the way, you had all sorts of other important things to say. I'm not suggesting that, but I'm just suggesting that when I walk away from these presentations, I kind of like to have like a 1 or 2 or 3 sentence explanation of what this thing is and can I rub it, right? And you told us what this thing is. Sprains are ligaments. Later, we're going to learn about strains. Strains are muscular. Sprains are ligament. Strains are muscular. That's the big difference. You actually want to have a strain as opposed to a sprain. Sprains are ligaments, and they usually take longer to heal because that tissue is really strong, but it's highly avascular, so it heals slowly. And yes, you can massage it. Yes, you can. Basically, if it's not swollen, you can massage it. Yes.
Okay, and the type of massage will be, because this is very common. So I just have all these questions. So when you're massaging, what type of massage is recommended? A little stretching, because that part has been like stretched back. So it's like a little stretching, or just like what type is soft, or what will you do?
I guess I wouldn't even say soft or hard. I'd say blunt. So here's what I mean by blunt. This is a sharp move. This is a blunt move. Blunt means it's flat and not diggy. And so I use blunt moves on joints. Blunt moves on joints are flat moves. I use diggy moves on muscles quite often. It depends, but you could use blunt moves on it. I think you could even stretch if it's gentle. We're assuming this is not a completely torn ligament. If it was completely torn, there'd be swelling and all sorts of problems. But I agree with you. You're not trying to stress it out. So gentle stretching with some blunt rubbing would be very good. And again, you tested everybody. You do a little bit of work on it and you see how it is the next time you see them. Don't try to solve their ankle problem the first time, because they might come back and say it got a lot worse after you worked on it. It does happen. And then it starts swelling. And you can just be like, okay, well, we won't do that again. And no harm done. They're going to live. It's going to be fine. You know what I mean? But I don't like to go to town on them, 2-hour massage in their ankle the first time I see them, and we find out that was the wrong thing to do. So, 15 minutes max on that problem, and let's see how it goes before we make more determinations from there. And blunt. Think blunt when it comes to joints.
Okay, thank you.
It's kind of funny. Okay, Mr. Tate. Sir, you very graciously agreed to go a while ago, but now we really want you to go.
Okay.
Thanks, sir.
So I had, fractures.
Yes, fractures. Tell us.
So a fracture is a disruption or break in the bone.
Yeah.
Disruption. Yeah. And that's it, kids.
Yeah. Can you massage them?
Well, while it's broken, no. Yeah. If it's in its cast, you have to elevate the, and then you have to have a doctor say that it's okay to massage the leg. I do have more. I was just playing. Some interesting information about it is that there's 2 different types of a break. There's a complete break or incomplete break.
Yep.
And a complete break is when it's meant for multiple pieces.
Yep.
And then obviously the other is not. And then there's open, and that's when it busts through the skin. The most common break is I'll just read this off what I got here. So I have so the upper extremities are usually broken when you try to catch your fall, and that happened to me. So I forgot that I actually had broken a bone before, because I used to pride myself to say I've never broken anything.
But you have.
But I have. Yeah. I have, yes. One time I was riding my bike and I fell off my bike and I tried to catch myself. Yeah. And I broke my hand. Yeah. So there.
So you've broken your hand.
Also, Okay, so somebody had osteoporosis.
Yeah.
You had mentioned that you knew you didn't have a broken hip. I think that's what you said, something like that.
I said I don't have osteoporosis, so I didn't break my hip. Yeah.
Yeah. So normally it's what was the word they use in this book? predisposition
Predisposition
of the fall, or I guess yeah.
or you mean I knew ahead of time that I was falling?
No, they're saying that in elderly people, when they fall and break their hips, they usually assume that if they have osteoporosis, if they have osteoporosis and if they fall and break their hip, they're assuming that there's a fracture already in the hip when they have fallen. So usually that's before the fall.
Got it.
I just thought that was interesting.
That is interesting. So you're saying there was a pre-fracture there.
Yeah.
It was minor, and then the fall was enough to make it full. I like that. And I like what you said, basically.
Another fun fact.
Go ahead. Go ahead, sir.
Well, as massage therapists, like it's isolated, or what's the word we use?
What is the word?
A local
yes.
A local contraindication. I highlighted the shit on my notes, and I double highlighted. So they're like, it's almost like this black, so I can't really see them. I'm sorry. Like,
well,
look,
don't be sorry though, because you've actually. I love it, because everything's important to you, sir. I love it, sir. You already said the important stuff. A fracture is a break.
Okay.
They can be total or partial. They can go through the skin or not, and they're a local contraindication. You can massage most people that have got a broken bone, assuming the broken bone's been treated. They didn't break it on the way in.
Yeah.
It's just a local contraindication, and it's all good. Yeah.
Mm-hmm.
Well done, sir.
I have a picture as well. I have a picture.
You do? Can you show us a quick picture?
What a break looks like. Yeah. That's an X-ray of a broken leg.
We don't see what you're showing.
Oh, it's on my.
Oh, yeah. Yeah, that's cool, actually. That's the fibula. The smaller of the two bones in your leg, it makes sense you'd break that first. It's easier to break. That's a good picture, actually. That's a full break, man. All right, thank you, sir. Good job. Good job. It was good job.
I have a question. Was that a hairline fracture on the tibia? I mean, the fibula? No? Oh.
No, hairline fractures, the bone is still together, and there's like this little crack, like a crack in tile or something in your house. This thing is separated. That's a full break. That's a pretty bad break there, actually. I mean, they're going to be fine, but that's a break. You get hairline fractures all the time and don't know it, probably. Miss Trotter. Miss Trotter, hello. Will you please tell us about subluxations?
I'm going to try to figure out how to show stuff again.
Okay. Well, keep practicing. You're doing good.
Oh, this is weird. Oh, hang on.
You got this.
Okay. Can you guys see it?
Yes, we can. We see this subluxations with a beautiful wavy background. Yes. Take it away.
Okay. Cool. All right. So, subluxations are well, it's a term used to describe when a joint I'm sorry. It's pretty much when like a joint is not like, and it's oh gosh. It's when a joint that may not work in the way it should. Rather, it is kind of like out some, I guess. Or it's not like in its proper place. It can occur in multiple body parts. You can see it in your feet, shoulders, wrists, or knees, but the most common place happens in the spine.
Yeah.
And we have multiple pictures kind of showing. My description was horrible.
That's good.
But what causes a subluxation? It often occurs from a result of a trauma or an injury to the joint. So like blunt force or overuse or hyperextending. So like if if you get into a car accident or have a sports injury, or if you have like several falls or like one really bad fall, or if you like people that golf a lot, or like I guess it's like jumpers be, so it's people that kind of do like the high jumping, that in the track and stuff, or even if you like hyperextend it and like it goes way past than what it's supposed to, like the regular range of motion. Um, it can also occur as a result of loose joints. So people that have uh, generalization joints or fixation, and like I guess the people that kind of have like they're able to kind of like normally, like the people with the extra joint, like if their joints are like looser,
People that are hypermobile.
Yes, that's what I'm trying to describe. But yeah, it can happen to them too. Like they're like actually more prone to have that happen. And then like symptoms of subluxation is like dizziness or balance problems. They have a reduced range of motion, muscle tightness or weakness, or spasms in the muscle. You get pain, soreness, and like tenderness, numbness, or tingling sensations. And then that happens normally around the joints. There's normally bruising as well, and it pretty much feels like when you crack your knuckles or your neck too hard, but the pain doesn't really go away fully, and it stays a lot longer.
Yeah.
And then they say it can be like serious, like subluxation can be serious. Normally, chiropractors or medical like field professionals, like doctors and stuff, they're normally they are more engaged in this stuff. Like they have like, oh yes, you have this type thing, because they actually diagnose and we can't.
Well done.
And then there's also like treatments for it. So they say rest. You can ice it, the area, compressions, and sometimes they put you in like a splint or a brace or something, even cast sometimes if it's really bad. Elevation, depend like if it's an area that can be elevated, it's like your wrist, you would elevate that. Pain medicines, so like Advil, ibuprofen, and then sometimes you need surgery, but majority of times they don't want to do surgery because it can cause more problems. And massage can be used to help with it, because it puts more blood flow in the area, and it helps like speed up the healing process because of the blood flow is going in there more. So.
Well done.
Yeah. That's it.
Thank you. That's good. So I love some of the stuff you said. Subluxations it's a term, by the way, normally used by chiropractors. It does not mean other people cannot use that term, but is heavily used by chiropractors. They're usually talking about your back, and they're talking about your spine being a little bit out of joint. By the way, it's not a lot. Those pictures that Ms. Trotter showed, which were great pictures, exaggerated for our learning, but it doesn't take much of your spine to be off just a little bit and to kind of hit the nerves and back a little bit. So they'll be like, oh, you've got all these subluxations back here. They mean you are slightly out, but they don't mean like your vertebrae are off one another. I mean, that stuff's tied together very, very tightly. It doesn't take much. And so it does mean a dislocated joint basically, but they don't mean fully dislocated at all. They mean slightly off, slightly tweaked, like, oh, I've gone to the chiropractor before too, where they're like, oh, your elbow, pop! It's just a tiny bit out, you know, and they just kind of get it right back lined up. So really, really well done. Joints that are slightly out of whack, slightly out of alignment, usually used by chiropractors. Thank you, thank you, thank you. Miss Routson, dislocations.
Yeah, so Miss Trotter basically described like a semi-dislocation.
Yeah, that's exactly
and,
right. Good way to put it.
So displacement of bones within the joint where the articulating surfaces completely lose contact with each other. Dislocation is temporary, but is pretty painful. Typically, one bone stays in normal position while the other bone is forced out of its normal place. The most common areas that are the most common joints that are dislocated are the shoulder, the knee, the hips, the fingers, elbow, and wrist. You'll know you've dislocated it because it's just really painful and you can see that it's, disfigured. It's not looking right, especially at the shoulder. You're going to have swelling, bruising, muscle spasm, and stiffness. You're going to want to get to a medical professional right away so they can make sure that no surgery is necessary to put the joint back into its proper place. They have procedures called reduction and traction to make sure that happens. And sometimes in the more serious situations, reduction and traction does involve surgery. Afterwards, you're typically placed in a splint or orthopedic cast. They really recommend lots of rest until the swelling goes down. Alternating ice and heat therapy. While your joint is healing, you do want to maintain range of motion in the joint without being too strenuous. So waiting till the swelling goes down and gently working on range of motion. You can massage it, but it says to wait until it's not swollen anymore and just use a lighter, more tolerable pressure. Checking in with your client to see what they can comfortably tolerate. I've dislocated my shoulder and I had to do a lot of massage. It's never been the same.
It messes up all the soft tissue in there once you've kind of popped it out.
Yeah,
well
I
said.
just have to take it easy on it.
I love what Ms. Routson said, though. Dislocations are the joint is not in socket. Subluxations are, it's out of whack. That's a very good distinction to make. When a chiropractor says your back is subluxated, he does not mean your back is completely out of whack. That's a dislocation. That's a much more serious thing. You won't hear about that with backs. You're paralyzed if you have a dislocation in your back. So anyway, dislocations are a full dislocation. The joint is not matched up. And yes, when people are healing them, you may not want to stretch them, but you might want to perform range of motion. Range of motion is not me trying to get my arm to move more. It's just me taking my shoulder, for example, through general movements. So the massage therapist might gently move you just as far as you can comfortably move to keep your shoulder moving so that soft tissue doesn't harden up and you don't lose mobility later. So that's a big thing in rehab, is range of motion, at least keeping the motion going. Yeah. Thank you, ma'am. Bursitis, Ms. Vincent, bursitis.
All right, bursitis is the inflammation of is it bursae or bursae?
Yes. Yeah, I think bursae is one and bursae is multiple, but yes.
The bursae sac, and those sacs are just little fluid-filled sacs that act like pillows for the bones, tendons, and muscles near joints. Bursitis most commonly occurs in joints that perform repetitive actions, and those joints would be like shoulders, hips, elbows, but it can really occur in any joint. An example would be a baseball pitcher might get, excuse me. For example, a baseball pitcher might get bursitis in the shoulder from pitching because it's something he's doing over and over and over again. And some symptoms are stiffness, pain in the affected joint, and it will hurt to the touch and be red and swollen. It might not be that great to massage it because it'll be tender for the client. It'll be painful for them, but you can massage the surrounding areas, and it might help loosen some things up.
Good. I love what you said, Ms. Vincent. She goes, it's inflammation, itis means inflammation, of the bursae sacs, and she said the bursae sacs are little pillows for your joints. And that's exactly what they are. They're little lubricating pillows little baby pillows that are lubricated to let tendons and ligaments slide over them. That's what they are. And so somebody who throws a baseball a lot, by the way, there's tendons and ligaments sliding over this burst site all the time. And you throw a ball 300 times, it starts to get worn down and inflamed. Yeah, really well done. It is massageable if it's not too swollen up. It can help by getting blood into that area. And you have to just test it out and do blunt work and see how it goes. Yeah. Thank you. Thank you. Thank you. Don't ever worry about the kids in the background. We get it. We get it. I don't know if you know this, Miss Vincent, but actually, strange, but every single person in this class was a kid at one time. I know. I know.
It's ironic because they've been super awesome and quiet until that.
Until that moment, of course. Well, they know when you need them to be quiet. Yes. But it always cracks me up when you get on the plane with a kid and people are like, "Are they going to be quiet?" And I'm like, "Were you ever a kid? Like, what's going on here?" Okay, Miss Walker T. Quickly Baker cysts.
Okay, quickly. A Baker's cyst is also known as a popliteal cyst. So that kind of lets us know where it is. It's right behind the knee. It is when the bursa sac right there in the back of the knee fills with fluid because you normally have an injury in the knee, such as arthritis or maybe a cartilage problem that encourages the knee to create extra synovial fluid, and that extra fluid fills up that bursa sac and makes it big. So of course, because it's right behind the knee, it will create problems in like knee flexion and just feel stiff. It can feel sore, but you can massage it, but you want to use a light, gentle, steady pressure to massage it. Like if you were to gauge it, would be like on a 3 on a scale from 1 to 10.
It'd be great if the cops bust in during this thing too. Because in my mind, you're also an international drug smuggler, Miss Walker. I don't know why. I just have to do it. Yeah. Because, of course, you got this covered. I love what she said. So you're telling me that a Baker's cyst is bursitis in the back of your knee.
Yeah. That's
cool.
That's exactly what I said. I used those exact words. Yeah.
Thank you. Well said, madam. Thank you. Miss Walker Y, can you quickly tell us what adhesive capsulitis is?
Okay, I have like 3 things to say about it.
Oh, good.
So it's also adhesive capsulitis is also known as frozen shoulder. It's a condition characterized by stiffness and pain in the glenohumeral joint. It's basically when the joint becomes thick, stiff, and inflamed. And you can definitely massage it as long as it's not inflamed. Deep friction of the shoulder muscles is actually good for reducing dysfunction. It improves range of motion and it decreases pain. So like deep pressure is actually good for it.
Yeah. Can I interrupt? Or maybe I'm not even interrupting. So beautifully done, by the way. Adhesive capsulitis is something called frozen shoulder. Usually what happens is somebody injures their shoulder, they stop moving it for a long period of time, and now they can't move it. And when it's really bad, you go into surgery, they knock you out and they break it free. But as a massage therapist, you can get in there and start digging around, and you can actually get into the joint and slowly over time work it back out again and get it back to normal, basically. So it's frozen shoulder. It actually responds well to deep tissue, and slowly, like literally, I'm like when I worked on people with frozen shoulder, I'm really like digging in here and trying to lift their shoulder up. And I might only get it up an extra inch that day. The next day we work it more and we twist it around. You're trying to put movement in the shoulder, deep tissue with movement in the shoulder. Well done, thank you, ma'am. Miss Jung, scoliosis. Jung, you have scoliosis. And
hi.
Hi.
Go ahead. You.
And I'm going to help you by putting up a picture too of scoliosis, because it can't hurt. A picture is worth 1,000 words in any language. Okay, Ms. Jung, tell us about scoliosis. Just what is it?
Yeah. What is scoliosis? Scoliosis is a medical condition.
Yes.
A person's spine is lateral curve. It looks like S or C shape. shape. The curve can be 10 degrees or more. What are the symptoms? One shoulder is lower than the other one. Rounded shoulder, uneven shoulder, and chest shape. Tingling numbness in the legs.
Yes.
Tiredness. Breathing problem. Heart problem.
That's it.
That's it. I think I actually understood every word you said. I'm going to repeat it and summarize it for everybody, but I was very impressed. So, scoliosis, she said, is a lateral curve of my spine. My spine, this is not, lordosis is an exaggerated curve of my lower spine.
Yeah.
Kyphosis is an exaggerated curve of my upper spine. Scoliosis is a curve where there should be no curve. My spine's supposed to curve front to back. That's cool. It is supposed to have no curve left to right. Scoliosis is a windy mountain road. And you will have clients, I'm sure some people in this class have scoliosis. It's a very normal thing. You see lots and lots of it. Some people have it extreme, some people don't, but it's lateral curves. And I love what she said too, a symptom of it, and she's right, is one shoulder is higher than the other. Yeah, you'll see a lot of this. I'm actually making a scoliosis in my back right now, and it causes you to do stuff like kick your hip out and pull your shoulder over to try to even out. And so that is definitely a symptom of it. And because it's the spine bent, it can send all types of referred pain down to parts of your body. Very interesting thing that you will all see in scoliosis is one side of the back will be tight in one area, the other side will be loose. The next side will be tight, the other side will be loose. The next side, it goes back and forth because your body's trying to deal with this very weird curve going down your back. Anyway, you'll know it. Someday you'll do it by accident. You'll go down somebody's back like this and you'll realize your hands are doing this. And you'll be like, oh, it's dark in here, but they have scoliosis. So anyway, that is scoliosis. It is an I hate to use this term even, but it's an unnatural curve where there shouldn't be one, laterally speaking. When the person should be straight, head on, their back is going lateral, curving. And there's, I mean, sometimes they put rods in people's backs. Some people it doesn't bother that much. Some people it does. All that kind of stuff. In massage, we're usually just providing some alleviation, to be honest with you. We're loosening up all those tight muscles because they're pulling on them all over the place. But yeah, that's scoliosis. Good job. Good job. Thank you. Thank you, Ms. Jung.
Thank you.
Yeah. And I understood every word you said. That was really good. That must be very hard. It's very hard. I'm very impressed. I don't usually understand every word I say, so I'm very happy about this. Okay. All right, everybody. That is the end of our presentations. You do have some homework tonight. Almost all of you, by the way, it's okay if you didn't. This isn't me scolding anybody. Almost all of you took advantage of the fact that you were able to take your test over the weekend, so that test that's due tomorrow for most of you is done. And you did very well on it. There are 4 muscle videos to watch and comment on tonight, and that's it. So 4 muscle videos to comment on. You know what I'm going to ask. Origin, insertion, action. I'd love it if you put it in your own words. Might bring a tear to Tapscott's eye. If you let me know you didn't just cut and paste it in there and you thought about it a little bit, that'd be cool too. But we'll take whatever. Things to think about. It is now 1 minute till 6. Very good day. Sorry, it's a lot of presentations to listen to. It is. Tomorrow, though, we're going to discuss these muscles. So you know how excited I get about muscles. So anyway, and we've talked about 2 systems of the body so far, which is the integumentary system, hair, skin, and nails, and skeletal system, which is basically your bones, ligaments, and associated soft tissue, your joints and such. Anyway, great day. Thank you once again. You were all very brave in presenting. I really appreciate it. I look forward to seeing you all tomorrow. We are just getting started on this wild ride. Trust me. And it's going to be a good one. I'm really happy to see everybody still here. I think that we are going strong. I'm feeling very good about this. If you need anything from me, email me, call me, text me, whatever. No, email me if you can. And have a great night, everybody. All right? All right. Bye-bye. Bye-bye. Bye-bye.
Thank you, Mr. Textat.
Thank you.
Good night,
Thank you, Miss Sarno.
Good evening.
Good evening.
Bye, Mr. Topstone.
Bye, Mr. Tate. Thank you, sir.
You're welcome.
Bye-bye.
Bye. Thank you.
Bye, Miss Karate. Bye, Miss Jong. Good job.
Bye.
That was good. Lateral curve of the spine. It was good. I liked it. Yeah. It's good. Everybody did good.